Hello, I am Dr. Bland, and today we are talking about Aduhelm. That's aducanumab. That is the medicine that the FDA has just approved for treating Alzheimer's disease. Now, if you told me, hey, Dr. Bland, we just found a medicine that's going to treat Alzheimer's disease, I'm excited. That sounds great. But then you tell me, but we're not maybe sure everyone thinks it works, and those who do think it works have some pretty maybe questionable evidence about how much it works, and wait until you find out how much it costs. Maybe I get a little less excited. So let's go ahead and talk through it so that you have some idea of what is going on with this new medicine, Aduhelm. So, Aduhelm, what is the question going on with this? Because if you tell us there's a medicine that treats Alzheimer's, it's supposed to be wonderful, right? But here's what's going on. So when they got to the phase 3 trials, they actually stopped it because there was a question about if it was actually doing all the things that it was supposed to and if it was actually doing any good. Then they took some time and went through all the data, and as they were looking at those 2 phase 3 trials, one of them actually looks like it didn't help at all. A negative result, just didn't do anything, right? Spent a lot of money, didn't get anything done. Then the other trial seemed to show that there was actually some benefit. Not necessarily a ton of benefit, and there's a question on if that benefit was lab values or actually improved quality of life in the patients. But it's question marks, right? So what the FDA did is they had one of their subcommittees go ahead and talk about this. The subcommittee's name was the Peripheral and Central Nervous System Drugs Advisory Committee, the PCNS. And they had a meeting and they discussed all this, and they seemed to say a couple of pretty clear things. First of all, they seemed to agree that, at least a number of them did, of the 11 voting members here, they seemed to think that, okay, this did show a improvement in radiographic evidence for Alzheimer's. So Alzheimer's is a disease that is known to basically be clinically proven in terms of testing by amyloid plaques that you can see in the brain. And this drug, this Aduhelm, is known to have reduced the imaging of these plaques in the brain. And it seems like, based off the testing, that actually seemed to work. It got better. That's actually addressed in the letter that the FDA put out when they put this approval out. That they said, hey, this makes the radiographic evidence better. The further question is, does that make the patient's life better, right? If I tell you, hey, your cholesterol went down by 5 points, does that make your life better? Do you know, does that do anything for you? Do you feel better with your cholesterol 5 points better? Did that actually result, and would that result in a patient having better memory, better mental function, a slower cognitive decline? Because that's what Alzheimer's does. It just slowly takes your mental function from you. And the question mark is the thing there. But they did say, yeah, it makes the pictures look better. The next question that they had to ask is, okay, looking at the fact that one of these trials was shown to basically have a negative result, didn't actually do good on statistics, and the other one seemed to think it does, should we just go ahead and assume that the one we're going to listen to is the one that showed the good benefit? And the PCNS subcommittee, that committee, seemed to say no. They said that that's not actually the recommendation. We shouldn't just trust. When we have one trial that says nope, one that says yes, we shouldn't just go, well, clearly yes is the one we want to listen to. Despite the fact that that was the recommendation they put forward from the subcommittee, the FDA put the approval out for this medicine. Now, I think that it is important to look at what might be some of the motivations, particularly based off the descriptor that was the narrative that was put out by the FDA about this. I think it's fair. I like to generally assume good meaning things from people. So I think it's reasonable to say if you're on this FDA committee, you are a human being. You probably don't want to see people suffering from Alzheimer's. I mean, no one really does. Alzheimer's is a horrible disease. And you're saying, you know what, this is a horrible disease. This is getting a lot of people. This is destroying lives and families. And man, if we had something that might help, that'd be great. So it got approved with maybe not the most obviously positive evidence, under the hope that we might be able to help some people out. The other thing you have to think about is with this medicine, this is not like a tablet that you take home. This is not like, hey, I'm going to take my cholesterol pill every day. That's not how this works. This is a weekly infusion. You got to go to a center, get hooked up to an IV. They run an infusion through you. You're supposed to get an MRI before you start, an MRI at, I believe it's 7 and 12 weeks, so multiple MRIs to check for the resolution of these amyloid plaques in your brain and to check for the side effects, because there are side effects. This is not a drug that is known to be completely harmless. 35% of the people who got to the full dose range, the 10 milligram range, 35% of them, that's a full 1 in 3, had picture evidence of what they called ARIA. And ARIA sounds very nice, doesn't it? ARIA. But ARIA stands for a symptom on picture that is hemorrhage or swelling of your brain. So you can get an ARIA-H for ARIA hemorrhages. You get an ARIA-E for ARIA edema, which is swelling in the picture of your brain. So they take a picture of your brain, they go, oh, that is more swollen than it used to be. That's ARIA-E. And that is 1 in 3 people got that. And then of that, more than 20% also had evidence of microhemorrhages, so small bleeding around their brain from this. But remember earlier I said, well, maybe picture evidence that an amyloid plaque is getting better, picture evidence that this medicine might be helping solve Alzheimer's doesn't necessarily result in a better life. Because the question is, well, how does that person feel? How do they think? How are they doing? And a picture doesn't actually necessarily show and might not actually change how they're living, right? And I think it's important to be honest and say, well, when we're looking at picture evidence of bleeds and of swelling in the brain, which sounds extremely scary and quite frankly is a little bit, that's concerning, you have to think about how many people actually had symptoms of these things. And it really wasn't that many people, actually. When you think about it, it was like 1 in 4, somewhere around there. There's like 25% had some level of symptom. And some of those symptoms varied. It was extra confusion, dizziness and vertigo. A couple people had some visual changes and headaches, right? So those are the type of symptoms that most people seem to have with this. But that's an important thing to think about, right? Because you have to weigh the risks versus the benefits of every medicine. The other thing that I think is important to think about, particularly when we look at the fact that this is a health system issue, right? Alzheimer's affects all of us, is the cost. I'm going to go ahead and give you a second. Just go ahead and guess what you think a course of this treatment might cost. Go ahead and just come up with a number in your head. If that number was $56,000, then you're right. $56,000 is what a year this medicine costs you. It's an incredibly prohibitively expensive medicine. So I think there are some things that we need to think about. Love that a company was willing to try and invest in trying to come up with something for Alzheimer's. Because right now, if you get Alzheimer's, it is a slow decline until you die. There's not a nicer way to say that. It just takes everything from you until it takes your life. And Alzheimer's has destroyed a lot of people, and an attempt to make it better, I'm a big fan of, right? But the question is the call to just do something, has that resulted in a win in this case? Is this medicine clearly a win? And I don't know that it clearly is a win. Part of what the FDA has said is that they're going to approve it with the condition that they will continue to study this, that there will be another trial ran to really try and narrow down, does this actually work in large, wide-scale distribution, and keep track on this. And if there's a bunch of problems that come up, then they're going to stop it. And if it doesn't look like it's doing anything, they're going to stop it. But they are deciding to essentially give the country a chance to try and see if Aduhelm helps out with Alzheimer's. And quite frankly, I don't know if it will or won't right now. And I'm not sure that anyone really does. So you're going to have to think about if this gets approved and if Medicare decides to pay for this, is this something that you want for your family? Is this something you would want for yourself? And I think it's kind of a judgment call. And I don't necessarily think there's a true right or wrong here. I just think that it's fair to be honest that we don't have 100% answer. This medicine does not claim to cure Alzheimer's, only slow it down. And again, there are questions about the evidence, there's questions about the risks and the cost. And so I think it just comes down to a personal family decision on if you think that this is worth it for you. And that's a thing that you're going to have to discuss over with your family and discuss it over with yourself and just see where you think about it. Obviously, we're all hoping that this ends up being a fabulous medicine. I just think we're all a little unsure of where it will end up on the scale between not worth it and, oh my gosh, what a wonderful thing. And I think time will tell. So the best I can say right now is let's just keep our fingers crossed and hope it ends up being wonderful. Because I would think it would be great if we could find something that could beat Alzheimer's. I'm just not sure this is it.